Hello, good morning and welcome to Sophy Ridge on Sunday. The dust is still settling on Thursday's autumn statement, but a potential new row over Brexit might be about to disturb the uneasy truce among different wings of the Conservative Party. The Sunday Times claims that ministers are considering a closer Swiss-style relationship with the EU. Now, for most people, of course, the immediate concern is the economy. Inflation hit 11% last month, and we're told the UK is probably already in a recession that could be the longest on record. All that as the NHS is showing increasing signs of real strain, with waiting lists and waiting times soaring. And of course, we're still a couple of months from the depths of winter. We'll discuss it all with our guests this morning. In just a moment, we will be hearing from the Health and Social Care Secretary, Steve Barclay. For Labour, we'll talk to the party's Shadow Work and Pensions Secretary, Jonathan Ashworth. Now, the NHS Confederation represents the health system in England, Wales and Northern Ireland. We'll talk to its Chief Executive, Matthew Taylor. We'll also be talking about Awab Ishak. He's a little boy who died after developing a respiratory condition from living in a mouldy flat. We'll talk to the social housing activist, Kwajo Tweneboa. And the former Children's Commissioner, Anne Longfield, will also be on the programme this morning. Good morning. Now, it could be an exceptionally difficult winter for the NHS. Record waiting times, hundreds of thousands of nurses threatening to strike, and soaring inflation squeezing budgets. Well, now, health did get extra cash in the autumn statement this week, but social care reform was yet again delayed. A little earlier, I spoke to the Health Secretary, Steve Barclay. We've just had another COP agreement where the wealthier countries are agreeing to send more money to aid those who need more assistance to tackle climate change. Obviously, for many people, they will see that as a great idea, but some of our viewers might be thinking, hang on, we're in a cost of living crisis here at the minute. Our debt interest payments are soaring. Can we really afford to do this?
Well, the detail is still coming in. That was obviously agreed overnight, so we need to look at that detail as we get more information. But of course, the UK, through its overseas aid budget, has always played a role in terms of tackling climate change, supporting countries around the world in terms of the measures they're taking. So we need to look at whatever's been agreed in the wider context of our international aid package.
Now, I want to talk to you about the NHS. There's lots I want to talk to you on that. However, before we do, the Sunday Times is reporting on Brexit that the government is considering a Swiss-style relationship with the European Union. Now, that would mean relatively frictionless trade, but it would also mean paying more money into the EU budget and almost certainly higher immigration plus an increased role for the European Courts of Justice too. Do you recognise these reports?
No, I don't. And if you look at the autumn statement, what the Chancellor set out was our determination to maximise the Brexit opportunities in high growth areas, whether that's in green industries, whether it's in life sciences, whether in financial services. And in fact, there were specific announcements in the autumn statement in terms of Solvency II. We've got a Prime Minister who himself supported Brexit. I myself did and was Brexit Secretary and worked very hard to maximise our control of our laws, our borders and our money. So it's absolutely important that, particularly in those high growth sectors, such as financial services, life sciences and the green industries, that we really use the Brexit freedoms we have. And so I don't recognise this story at all.
Could you ever support that kind of agreement?
Well, I don't support that. I want to maximise the opportunities that Brexit offers. That's what I worked for as Brexit Secretary. And as the Minister responsible for life sciences, I see huge opportunities for the UK in being agile, in moving at pace and having a regulatory system that is absolutely tailored to the UK needs.
At the same time, Jeremy Hunt has said that he wants to remove the vast majority of trade barriers with the EU. I mean, if you're really serious about doing that, then this is the kind of thing you need to look at, isn't it?
Well, the point is it's in both sides' interest to remove barriers. We trade with each other. We're important partners to each other. So that's mutually beneficial. And, of course, we want to work constructively with EU partners to do that. But that's not at the expense of maximising opportunities in high-growth sectors. And the autumn statement signalled our determination to do that, for example, with the announcement on Solvency II.
I just want to talk about the autumn statement with regards to Brexit, because the Office for Budget Responsibility, you know, the official independent watchdog, were pretty clear on what they thought about it. They said that Brexit will result in the UK's trade intensity being 15% lower in the long run than if the UK had remained in the EU. The latest evidence suggests that Brexit has had a significant adverse impact on UK trade. And going on to say, via reducing both overall trade volumes and the number of trading relationships between UK and EU firms. Do you accept that Brexit has had, as the OBR says, a significant adverse impact on UK trade?
Well, I think there's dangers in looking at one little bit of the ledger in isolation. If you look at the vaccines rollout, whilst technically, legally, an EU member could have done things differently, I think culturally would not have done so. Well,
the question is, do you accept Brexit has had a significant adverse impact on UK trade?
Well, I think there's pros and cons, and the point is we have opportunities.
So that would be a big con, wouldn't it?
We have opportunities through the divergence opportunities I've just talked about, things like Solvency II, to get those pension funds investing in levelling up communities, better reflecting the needs of our financial services
market.
On trade,
specifically, do you accept Brexit has had a significant adverse impact on UK trade?
Well, what I'm saying is you've got to look at the issues in terms of Brexit in the round. There are areas where there have been difficulties in terms of greater friction, and we're looking to work constructively with EU partners on that. But equally, there are very significant opportunities as a result of Brexit. I don't think we would have done the vaccine rollout in the way that we did had we remained a member of the EU.
It sounds like...
And the significant regulatory opportunities we have, and the autumn statement signalled our determination to take those.
You're clear on what you see to be the kind of positives and the opportunities, but do you accept it has had a significant adverse impact on trade?
What I'm saying is there's pros and cons. It's very hard to model.
It's a very specific
It's very
question.
hard to model exactly what the impact would be. For example, we've just been through
the
pandemic.
OBR's done that, haven't they?
Well, of course, but I know from my time when I was Brexit Secretary just how difficult it is to model these things. Of course, we've been through a pandemic. That has had an impact. There's a range of things. But the point is, what matters is we maximise the freedoms that we have, take those particularly into the high-growth sectors, such as in digital, life sciences, green technologies and financial services. And the autumn statement signalled our intent to do so.
OK, now I do want to move on to the NHS, such an important issue. Many of our viewers will be really concerned about it. If I may, I just want to play to you what happened when our correspondent Fraser Ward went to Rochdale for this programme to ask people about their experiences of the NHS.
A lot of people go into A&E because they can't get a doctor's appointment, so then they're waiting 9 hours in A&E, which is ridiculous. I was a nurse, and I do think the standard's gone down an awful lot since I was nursing.
A lot could be done to improve it. I think it's struggling. It's pushed for funding. You're having to wait for appointments a lot longer than you were before.
There's not enough doctors. The waiting times are too long. I took my daughter there last week. We were sat in there for 6.5 hours. More staff. We need better staff. The waiting times, just for everything, is too long.
As far as the doctor's surgeries goes, can't get an appointment. It's shocking at the moment. I live in Milnrow, and my doctor's surgery, you can be on your last legs and you can't get an appointment.
What's your response to that?
Well, when Jeremy Hunt and I were last in the Department of Health 4 years ago, we put in place the biggest ever increase in medical undergraduate training, a 25% increase. Those doctors obviously take time to come on stream. They'll become junior doctors in 2024. So that gives an indication of our commitment to boosting numbers. We've got 3% more doctors this year than last year. And we're looking also at how we boost the wider primary care staff. We had a manifesto commitment on that and we're on track to deliver it. But I recognise as a consequence of the pandemic, GP appointments have been under pressure. We are seeing more people, 90,000 more GP appointments this year than last year. We're looking at what technology we can offer, some things like cloud telephony, so we avoid the ATM sort of scramble of calls to a GP on a Monday morning. So it's about the technology we put in place, it's about the wider skills and boosting those numbers in primary care, but it's also about boosting the numbers of GPs, and that's what we did by opening 5 new medical schools, where students started in 2019. But obviously, there's a time lag in those coming on stream.
They're talking about doctors there. They're also talking about A&E. And I just want to show you the latest waiting times graphic for A&E. It's pretty shocking. You can see there, this is the number of patients waiting more than 12 hours in A&E, hitting over 43,000 in October. Now, I showed the same graph to Jeremy Hunt when he was on the programme, and I put it to him that, this looks like a health service on the brink of collapse. He said there are massive pressures on the NHS, and I think that doctors and nurses on the front line are frankly under unbearable pressure, so I do recognise the picture you say. I mean, do you think the NHS is on the brink of collapse?
Well, what that graph shows, you can see, for example, firstly, that it's very much driven by the pandemic in terms of the huge pressure.
I'm just asking about the...
Well, let me come on to
what the situation we're in now.
Of A&E. Yes, and I recognise, particularly for staff, they're under huge pressure in NA, nurses, doctors working phenomenally hard, given what that graph shows. That is why, in the autumn statement, we prioritise, in particular, social care. 2.8 billion next year, 4.7 billion the year after. In 2024, we'll have £8 billion going into health and social care. And the reason we prioritised both health and social care is because of delayed discharge.
Do you accept?
13,500. If I can,
okay.
The key issue, when you see that graph, the focus tends to be on A&E or ambulances. What is causing that graph is the 13,500 delayed discharge, which often links into social care. And that's why we've targeted funding, a very significant amount of funding at a difficult time, into social care so we can tackle that delayed discharge, which ultimately is the way we get the times down in A&E. Just
briefly, because you talked a lot about what you want to do, and I'll talk about your extra decision-making when it comes to quangos or bonfires, or the pen pushers, as the Mail is putting it. But before we do you accept there is a problem with the NHS right now, that it's not acceptable?
Well, I accept it's under huge pressure, and that's because of the pandemic. Let me give you one example. The number of 52 waits for operations was 1,300 going into the pandemic. It's now over 400,000. So this is because of the pandemic. We face huge pressures. That's primarily the cause. What we've done is target things like delayed discharge, which is the way we get flow into hospitals, which is critical for shifting those numbers.
Now, the NHS got £3.3 billion of extra funding in the autumn statement, but according to the Mail on Sunday, you're calling for a bonfire of the NHS pen pushers. What does that mean? Well,
we've got 6.6 billion over 2 years, but it's important that we get maximum value for money from that. And if I look, for example, at the centre, at the Department of Health and its arm's length bodies, they collectively cost £2.8 billion. And I think the scope for us to look at what the costs are in terms of administration in the NHS, have fewer targets, devolve more decision-making.
On targets?
We now have the integrated care boards that can look at issues on a population basis, a much more localised basis. What I want to do is give more autonomy, more freedom to trust leaders, to our ICBs, so that they're not spending so much time managing upwards, which, in the feedback they give to me, is a constant source of frustration for them. So let's have a more streamlined centre, develop more decision-making to those on the ground. That's a better place to assess.
Just want to talk about targets, because you say that you want to cut hundreds of targets, but, targets are the way we monitor NHS performance, right? The graph that we just showed on A&E waiting times, that's how we know there's an issue with A&E. It's frankly how people like me can hold people like you responsible. Is there not a place for targets in the NHS? They're important, aren't they?
Well, there is a place for targets, but if everything's a priority, nothing's a priority. And risk, in my view, is best assessed on a population basis through the ICBs by local leaders. They're better able to tailor the priorities for the local needs, and we will have information such as through the federated...
Targets are important, right?
Of course, of course, and no one's suggesting we don't have any targets. But what I'm saying is there's £2.8 billion.
Do you want to get rid of the targets such as the A&E waiting times?
No, I think the A&E is a very useful target in terms of actually the wider system health within the NHS, and it speaks to flow, which is a key issue in terms of ambulance handover delays and people waiting in A&E.
Now, another big issue for you is strikes. The Royal College of Nursing striking for the first time in its history. Now, you told the Sunday Telegraph their demands are unreasonable and unaffordable. What would be a reasonable pay rise for nurses?
Well, what they're asking for is 17.6%. That would be an extra cost for £9 billion on the NHS budget. That, for your viewers, is around 3 times more than those outside the public sector are receiving. And that's why I think that is unreasonable. And of course, whilst pay is important, it's important to look at the package in the round. The NHS contributes a fifth of a nurse's salary into the pension. With their contribution on top, that means a quarter goes into a nurse's pension, 33 days plus of annual leave. So it's important to look at the package as a round.
What would be a reasonable pay rise? Do you think nurses' pay should keep up with inflation?
Well, we have a process to answer that question, which is the independent pay review body.
Yeah, but we know that you can comment on pay because you've just described their demands as unreasonable and unaffordable, so we know you can give your opinion.
Well, and my opinion is we have a process through the independent pay review body. That is why last year nurses got 3% when the rest of the public sector had a pay freeze. We have a process through the independent pay review body to look at these issues in the round. And of course, Sophie, it's not simply about pay. When I speak to nurses, they also talk about the estate. That's why we're investing in 40 new hospitals. That's why we've got a significant capital programme around the surgical hubs, the diagnostic centres. It's also about technology. One of the bugbears nurses tell me is often when the tech actually makes their job difficult and we haven't got the right tech in place. So it's not just about pay, it's about the wider conditions, and that's why I'm very keen to engage with the trade unions. I saw the General Secretary of Unison this week. I had a round table with union leaders. I met the RCN also last week. So my door is open. We're engaging with the trade unions. There are other factors alongside pay that we need to discuss, but we do have a process through the independent pay review body to look at these issues.
Now, this week, like so many of us, I've been really touched by the story of the little boy, Awab Ishak, the 2-year-old who died after he was living in a mouldy flat. We know, of course, the boss of the housing provider has resigned. Does the government need to look at itself as well? I mean, how are we living in a country where a 2-year-old boy can die from the housing that he's living in?
Well, it's heartbreaking, isn't it? And aside from being a minister, I'm also a parent. I've got 2 young children, and I think anyone sort of looks at that, regardless actually whether they're a parent or not, but I think just as citizens we look at that story, and it's a terrible story, and it's clear that it needs to be followed through. We need to look at what lessons there are. Clearly there were failures in terms of the way the local council acted. I know it's something that my colleague Michael Gove is taking a very serious look at and is very interested, and it's something that's heartbreaking for us all to see.
Do we need to really focus on housing at the minute?
Well, I think we need more housing. We need to boost that. I think that's important to intergenerational fairness as well. But I think boosting housing is separate to what were clearly some failures here where the family had raised concerns and those were not acted on. And we need to look into that.
Just finally, World Cup starts today. There's been some concerns, of course, about Qatar's treatment of women, the LGBT community, and also, of course, the migrant workers, many of whom were working on these stadiums. And yesterday there was this extraordinary press conference from the president of FIFA who said that the one-sided morality lesson is just hypocrisy, and he said that Europe and the West should be apologising for what we've been doing for 3,000 years around the world before giving moral lessons. What's your response to that?
Well, it's an international major event, and I think all of us are excited. We firstly wish the England team well. And also, just on the subject of sport, a huge shout-out to everyone in Rugby League. I think the tournament that they've just had, both the men's, the women's, the wheelchair, has been a fantastic showcase for sport and for Rugby League in particular. But obviously, in terms of Qatar, it's important that we engage. I think everyone will want to get behind the team. And it's a major tournament that we're very much looking forward to.
James Cleverly, the Foreign Secretary, said fans should respect the law of the home country. Is that right?
I think people should respect the law, whether that's overseas or in the UK.
Even if you don't agree with it, I mean, you can go along with it without respecting it.
Well, I think the law of the land, wherever you go, it's important to respect, yes. OK.
You going to be watching the World Cup?
Of course.
Who's your money on to win?
Like you, I think we all want England to win, and that's what we're backing.
Yeah, I definitely want England to win, but I'm not sure that's where my money would be going, I'll be honest. Thank you very much for being on the programme today. My interview there with the Health Secretary Steve Barclay. Now, as usual, The Take will follow this programme. That's just after 9:30. Our chance to analyse the interviews, talk through news lines with our Deputy Political Editor, Sam Coates. But I just wanted to get Sam's take on that interview with Steve Barclay before we move on and get Labour's take. Sam, there's quite a few news lines, I thought, from that interview. What stood out to you?
Well, Steve Barclay, in many ways, has just one of the most difficult jobs in government because he needs to be seen really turning around the health service in time for the next election, no more than 2 years away. And you heard from those voters that Fraser Maud was talking to, the Sky correspondent, about just how badly people think that the NHS is performing at the moment. And really, there seem to be two prongs to the government's approach. One, to put a bit more money in it, but also to try and reform it. Now, there is that story that you talked to Steve Barclay about getting rid of pen pushers and getting rid of targets. Now, it was interesting when you pushed him on whether or not targets actually help the patient rather than gum up the health service, because ultimately, if you don't have standards by which doctors and hospitals are being judged, if you don't have things by which health trusts can be judged against, how exactly are people going to be able to measure which parts of the country has a health service that's doing well, which parts of the health service are doing less well and need extra help and need extra improvement? It struck me that there is a sort of elephant in the room when it comes to the health service, and that is the workforce. Now, Steve Barclay is trying to present a picture whereby long-term decisions taken by him and Jeremy Hunt years ago do mean that there are going to be more workers coming on stream. But again, it'll be for voters to judge. It's so difficult to sort this out at the moment.
Thank you very much, Sam. There'll be more from Sam at 9:30 today. Well, let's get the Labour view on that, shall we? We can talk to the party Shadow Work and Pensions Secretary Jonathan Ashworth. Thank you for being on the programme today. Now, you're here with a different hat on, of course, but you were Shadow Health Secretary for a long time, including during the pandemic. We did lots of interviews on that. So I do want to start off with the NHS. What state do you think the health service is in as we approach winter?
Well, it's in a quite desperate state, isn't it? Not only are 7 million people on the waiting list, I think around 400,000 people now are waiting beyond a year for treatment. That's 4.5 Wembley stadiums, if you like. And of course, the typical wait for somebody who needs treatment has doubled from about 7 weeks to 14 weeks. The problem with the NHS is that there's an increased demand on the NHS, and there simply isn't the capacity to meet that demand. We are short of the doctors, the nurses, the paramedics, the clinical staff that we need, which is why we in the Labour Party have said let's impose get rid of the non-dom tax status and use as a proceeds from that to fund extra doctors and nurses. But we're heading into a very difficult winter, a winter that will be miserable for patients, but also it impacts economic growth. We've now got 2.5 million people out of work because of sickness, costing us £7.5 billion extra in sickness benefits. That's because many of those people can't work because they're waiting for mental health treatment or they're waiting for an operation. Now, one of the things I want to do as a Work and Pensions Secretary is use my years of expertise in health policy to reform the way in which we provide support in job centres and employment services to help those who are sick get back into work, because there's evidence now if you better integrate employment services with health services, with mental health services, you can actually support people to return to work. So the problems in the health service are having a direct impact on people's ability to go back to work and our overall economic performance.
Now, the other thing that Stephen Barclay said in our interview earlier was that he wouldn't support, he doesn't recognise and wouldn't support the front page of the Sunday Times suggestion that the government is considering a closer link to the EU, like a Swiss-style relationship, so access to the single market, which, of course, would mean things like paying more into the budget, higher immigration and an increased role for the European Courts of Justice. In principle, would Labour support that?
No, what we've talked about is that we need to make Brexit work. We obviously need to deal with the problems in the Brexit deal. And isn't it, ironic that we were told by Boris Johnson's cabinet, which of course Rishi Sunak was a leading member of as Chancellor, that we had this oven-ready deal, one of the best deals possible. And now it appears that Conservatives are briefing, suggesting that the deal isn't working out, and they want to return to something which is it's something more like Chequers. So the old Chequers proposals. Look, what we need to do is we need to fix the problems in the deal. We need to look at veterinary agreements so we can deal with agricultural products better. We need to look at our security arrangements. We do need to look at ways in which we can get more frictionless trade, because although the volume of trade on the world stage has improved, our exports performance is still disappointing. So there are changes that need to be made, but it is quite something that Conservatives appear to be briefing newspapers, or government sources appear to be briefing newspapers, suggesting that their own deal isn't working out as they told us it would.
OK. So you're saying, though, that the deal is not working. But I'm just trying to work out exactly how far Labour would go to improve the situation. I mean, would you be prepared, for example, to look at access to the single market?
No, we are not proposing returning to the single market or the customs union or anything like that. But we do want to negotiate a bespoke deal for the United Kingdom, and so that our businesses can export, so that we can get those agreements on agriculture, so we can work together on security issues. But we are not proposing that we just simply adopt the Swiss proposal, which the government now are apparently looking at. But of course we need to fix this deal. Of course we need to make Brexit work, because this oven-ready deal that we were promised, this great deal, has not worked out in the way in which Rishi Sunak and Boris Johnson told the British people it would do.
OK, a couple of other things that I'm keen to ask you about. Nurses are striking, demanding a 17% pay rise. Should they get it?
Look, what we very clearly said is that, of course, nurses and other public sector workers deserve a fair pay settlement, but these things need to be negotiated through the proper way. Now, Steve Barclay, I didn't hear his interview, I'm afraid, because I've been coming from another studio, but it's now incumbent upon him to get all the trade union representatives, the representatives of nurses, doctors, paramedics and so on, round a table to avoid industrial action this winter, because we know the NHS is in a desperate state and nobody wants to see our NHS staff go on strike. So he has to get them round the table to hammer out a deal.
I just want to come in, if I may, because obviously asked Steve Barclay about what he's doing on the NHS strikes, but I just want to get Labour's position. You're talking about the independent process, but that independent process is not going to give them a 17% pay rise, is it? So by that, do we assume that Labour also doesn't think that nurses should get the pay rise that they want?
Well, the health sector unions have rejected the recommendations of the independent pay review body processes. So it's now incumbent upon the Health Secretary, who, don't forget, in legislation last year took more direct control of the NHS. That was one of the things, it was actually under Matt Hancock and Sajid Javid, but they took more direct control of the NHS. So there's no hiding. The buck stops with the Health Secretary. If he wants to avoid industrial action this winter, he has to get those trade unions in his office on Monday morning to get an agreement and hammer out an agreement. Now, we've not got access to all the facts and figures in the NHS, because that's government information. But I am sure that if Wes Streeting was the Health Secretary, he would be getting the unions in for a discussion. And of course, we never had industrial action in the NHS under a Labour government.
Two more quick questions for you before I have to let you go. According to The Observer, Labour wants to abolish the House of Lords. Some would say that they've been the most effective opposition for 12 years of the last Conservative government.
There's obviously great expertise in the House of Lords, of course, and there's very good people in the House of Lords. But we need to bring it into the 21st century. It needs to be a modern second chamber, and therefore it should be elected. And I think when trust in politics is so low, because of the actions of Boris Johnson, and he's actually trying to make appointments to the House of Lords, which people feel or have felt is inappropriate, I think the time is right to democratise the House of Lords. But this is part of a commission that will soon, a recommendation from a commission that will soon be published. And all these matters will have a proper consultation on how democracy in the House of Lords, how it could be implemented, how the regional voice can be part of that, and so on.
OK, and now finally, the World Cup, of course, kicks off today. There's been lots of criticism of Qatar. Is it right for us to continue to talk about this, or do you think now perhaps is the time to focus on the sport?
Well, you know, I will be watching England, of course I will, and supporting England, obviously. No, I think we should continue talking about the issues, because Qatar's human rights record, particularly around how they treat LGBT people, but also the way in which the workers who have been building stadiums have lost their lives and been abused, it's quite right that the world focuses on that as well and puts pressure on the Qatari government, while at the same time enjoying football. So, look, I'm going to be watching England, but I think we have to continue to talk about these awful abuses that we see in Qatar.
OK, thank you very much indeed. Jonathan Ashworth there.
Thank you.
Now you're watching Sophy Ridge on Sunday. We've got lots still to come on the programme this morning. We are going to be talking to some immediate reaction to the Health Secretary's appearance on the programme with the Chief Executive at NHS Providers, Matthew Taylor. So that is talking about the NHS again. And of course, following the tragic death of Awab Ishaq, you know, the little boy who lost his life because of mould in his house. A little later, well, actually immediately, I think, we're going to be talking to the social housing activist Kwajo Tweneboa. Looking forward to that. Well, let's talk about that story now, shall we? We will sort that is Sam Coates. We're going to be talking to Sam after the programme in the take as well. Don't want to miss Sam out. Apologies there. Now, to return to the really tragic story of Awab Ishaq. Now, he, if you remember, of course, was just 2 years old when he died. He lived in a rented flat in Rochdale. It was a flat that was covered in mould that caused a respiratory disease that killed him. Now, yesterday, the chief executive of the housing association that rented the flat was sacked after he repeatedly refused to resign. But of course, it's not just Rochdale. There are cases of substandard housing across the country. The coroner who investigated little Awab's death said that it must be a turning point in those conditions. But is there any sign that things will change? Well, we're joined now by the social housing activist Kwajo Tweneboa. Thank you so much for being with us on the programme. We really appreciate it. The case just breaks my heart of this little boy. I'm sure you must sort of feel the same.
Yeah, I mean, it's absolutely horrific, and I've been campaigning for the last year and a half to avoid a situation just like this. But what we've seen tragically with the case of Awab is that he's paid the ultimate price for corporate neglect by his landlord.
Are you surprised?
No, I can't say I am. I mean, it's an absolute tragic case, but from what I've seen across the country in terms of tenants living under social housing landlords, whether that be housing association or local authority, is often they're living in similar cases. In some cases, even worse conditions for decades. Even I've spoken to one tenant who reached out to me for help after complaining for 27 years. That's longer than I've been alive, yet they weren't listened to.
I think that's it, isn't it? The not being listened to. Someone talking for 27 years. And, you know, the lawyers for Awab's parent read the statement from them. They said, we cannot tell you how many health professionals we've cried in front of. And Rochdale Borough housing staff, we've pleaded to expressing concern. We shouted out as loudly as we could. I mean, they're just being ignored. I mean,
it's absolutely devastating. His parents complained before he was even born about the damp and mould in his property, yet 2 years on, it led to his death. That never should have been the case. And I'm sure they would have been complaining to the likes of the repairs manager at Rochdale Borough-wide Housing, and they haven't been talked about in this whole conversation. Complaints would have gone directly to them. They would have overseen it. And we've seen in the last 24 hours that there's others on Awab's estate living in similar conditions. 4 years some people have complained for. This is a systemic issue, not just Rochdale Borough-wide Housing Association, but across the sector.
Why do you think people aren't being listened to? Do you think it's because of resources? Do you think it's because of racism, of class? What do you think it is?
I think it's a mixture. I mean, racism and class does massively come into it, especially from my experience. But I also think it's a stigma with social housing tenants. It's a cultural issue within the housing sector. And the fact is, landlords can get away with it due to the lack of regulation. I mean, for example, we're often told as civilians, nobody is above the law. And I think in the case of bad landlords, they shouldn't be exempt from that either, especially in cases like Awab, where it costs the life of an innocent individual.
So Gareth Swarbrick has been removed from his post as Chief Executive of Rochdale Borough-wide Housing. That's the housing association that rented the house. Michael Gove has written to every council leader in England and social housing provider. Do you think that change is coming?
Well, I have to say in the case of Rochdale Borough-wide Housing's chief executive having to be fired is an insult and disgrace, and I think it represents the culture again within housing and directors' boards. The fact that directors' boards only 24 hours ago was agreeing that he should stay in his post, even after that story comes out, is insulting for me. So I can't imagine what it's like for the family. Do I think change comes? Change should have come 5.5 years ago after Grenfell. We should not be sat here having the conversation about an innocent 2-year-old dying as a result of the neglect of his landlord, but here we are. Change really should have come then, so I really hope it does. I really hope the sector wakes up and does their jobs, realises that it's people's lives they're dealing with. It's not just a 9 to 5. I think that's what the problem is.
What would your message be right now to Michael Gove? You're obviously a very eloquent spokesperson for many, many people right across the country. What would your message be to him?
Well, I've spoken to Michael Gove and his team several times, and I'm glad the regulation's coming in. It needs to come in a lot quicker. I don't think we're being tough enough with bad landlords. I think in cases like this, to avoid cases like this, we honestly need criminal charges now. If it was any other sector, if this was the NHS, for example, and it was a doctor or nurse who had neglected their patient in this way and it resulted to a death, not only would they be struck off, that wouldn't even be disputed, there would also be a criminal investigation open, and we need to see it within housing too, because it's people's lives they're dealing with, like I said earlier, not just a 9 to 5.
I just want to sort of pause and give people a bit of a sense about the conditions that we're talking about. I think we can show a video of the kind of conditions.
So, guys, I've just woke up and it's getting worse, right? Absolute ridiculous. Look at this, right? Do you call this condensation? What the hell is that? Look. That is not condensation. Look at this, look. And it smells, it's rank, it's disgusting. And I'm not putting up with this, right? You expect people to live in conditions like this. Come on. Right, you see, on the window there's condensation, but the roof shouldn't be looking like that. Come on. Are you kidding me? Look at this. It smells and it's destroying the carpet and the paint.
I find that so shocking.
Yeah, I mean, I posted that 24 hours after our story broke a couple of days ago. And I want to bring up this point about damp and mould, because there's this huge misunderstanding with it, and often it's tenants blamed for the conditions that they're living in with damp and mould. They're told, stop drying your clothes indoors, open your windows, turn your radiators on. There are 300,000 different types of moulds, a lot of which can grow in your homes, and many of them require different ways to tackle it. However, across the sector, it's often the case that landlords send out contractors, like in this case, where it's just washed off with a bit of bleach and they hope that it doesn't come back, or what they do is they send a contractor around to paint over it and pretend it's not there. That's not how you deal with damp and mould, and now I hope they've learned that with damp and mould, it can cost your life.
What kind of conditions do you see?
Honestly, the list goes on. I've seen people's homes flooded with sewage, raw sewage. I've seen people's homes filled with cockroaches, damp, mice, mould, ceilings that have collapsed. I've taken tenants to A&E due to a ceiling partially collapsing on top of them. I have seen it all. You wouldn't even let animals live in these homes, the homes that I've seen, never mind human beings. And I think it's an absolute disgrace that in this country we allow that to happen with the resources that we have. And I mean, with these housing associations, for example, often the chief executives are paid 6-figure salaries, or in terms of surpluses, it's in the hundreds of millions. They don't have an excuse about not having enough money and funding. It's their priorities and lack of care.
And talk to me a bit about your story. You know, how did you come to be sitting here? How did you come to be involved in campaigning?
So I lived in poor housing myself, poor social housing, and we had been complaining to our landlord for many, many months, if not years, about the disrepair we were living in. Again, cockroaches, mice, damp, mould, kitchen that was nearly 100 years old, rotting, no bathroom light, no windows in the bathroom. And my dad became ill. He was diagnosed with stage 1 esophageal cancer. In those conditions that progressed, it was an aggressive form of cancer, progressed to stage 4. He was being fed through his stomach by nurses 3 times a day in those conditions. They struggled to bathe him, and still the landlord wouldn't do or fix or remedy the property. He then passed away, and things went from bad to worse. We were left over winter without a living room ceiling, and still they wouldn't come and deal with the other issues. And I said, enough was enough.
Oh, no ceiling on your living room?
Yes, so it was 3 stories, and it was the middle floor, and the ceiling had partially collapsed due to a leak. They came and pulled the ceiling down in October 2020, and they didn't put it up until January the following year, and they didn't fix any of the other issues at that point either. And I had just had enough and turned to social media put all the images and videos up on there, and it went viral and disgraced the landlord into not just completing the works in my home, but spending millions and having to complete over 800 repairs on my estate to other people's homes too, because it was falling to bits.
I'm really sorry about your dad.
No, thank
it's
you.
really, but it does feel like, you used his death to make huge change for lots of people. I'd be very grateful.
So. Thank you.
Just finally, be brutal.
Yeah.
I am very aware of our responsibility. And do you feel that sometimes there's too much focus on people who pay a high rate of tax, people who own their own homes, and not enough on rented housing, on social housing?
Absolutely. I think this issue with poor social housing, the social housing crisis anyway, has existed for many decades. Before I was even born, people have been suffering. I think more focus needs to be put on that. That's where the real issues are. That's where people's lives are being put at risk. And I sometimes think if before 2017, it was seen as a focus and it was like all over the news, MPs were talking about it, could we have potentially avoided the tragedy that was Grenfell had we have spoken about this earlier?
Thank you so much for being on the programme. It's been really interesting to talk and to see some of the footage as well, really quite sobering.
Thank you for having me. Thank you.
Pretty shocking. Really glad to be covering that story on the programme this morning. Now, of course, at the beginning of the show, the Health and Social Care Secretary Steve Barclay told us that he does recognise the NHS is under real pressure this winter, and he thought the Royal College of Nurses' pay demands, in his words, were unreasonable. Well, we can speak now to the Chief Executive of NHS Confederation. That represents the whole healthcare system in England, Wales and Northern Ireland. That's Matthew Taylor. He joins us now live from Leeds. Thank you for being with us. I'm interested to get your take on the interview with Stephen Barclay. First, he said he wants a bonfire of the NHS pen pushers, cutting bureaucrats, axing targets for efficiency savings. Is that a good idea?
Yeah, I mean, I'm not sure about the kind of slightly populist language of pen pushers and red tape and all of that. I mean, actually, the issue here is that the National Health Service is very centralised, hierarchical system, and it generates an enormous number of targets. Now, some of those targets actually come from politicians themselves. So I strongly support the idea that we should try to devolve more power in the health service so that local health systems, working with partners like local government, can find solutions that work for them. Too often, these national systems treat everywhere as if it's the same, and places are very different. And the Secretary of State has appointed Patricia Hewitt, who, of course, was Health Secretary of State way back in the Blair years, to try to look at how we can devolve power in the health service so we can have better local solutions. So we absolutely support that. We think it's a very good idea.
We are seeing, I'm interested to know about the state of the health service, because we're seeing, of course, long waits in A&E. We're seeing struggles to get GP appointments. We're, of course, about to go up into winter and the time when the NHS is under most pressure. Are you actually a bit worried about the health of the NHS right now?
Yes, we are in the midst of a gap, and that's the gap between the demand that we face and the capacity we've got. So on the one hand, we have an ageing population. So, for example, the year of our lives when we consume the most amount of health and care resource is the last year of our life. And over the next decade, there'll be about 25% more people reaching the last year of their lives. So you've got population ageing, you've got the pent-up demands of COVID. You've got, unfortunately, the fact that as a country, we have high levels of poverty. Poverty is strongly connected to ill health, as your last interview vividly demonstrated. So we've got a lot of demand, but then when it comes to capacity, we had 10 years of austerity when growth in health service spending was around half of what most economists say that we need. That meant we went into COVID, and there was research last week that showed this, about £40 billion less have been invested in the UK in comparison to EU countries in that decade leading up to COVID. So we go into COVID with over 100,000 vacancies, with a crumbling estate, lack of investment in things like IT, and COVID hits us extremely hard. The effect that COVID had in terms of, for example, waiting lists was much worse in the UK because we just didn't have that extra capacity. So we've come out of that, and this is the issue, this gap between demand and capacity. Now, we welcome the fact the Secretary of State has got more money out of the Treasury to deal with the impact of inflation. It's not as much as we need, not as much as we want, but we're grateful for anything that we can get. But what we really need now is consistent spending over the next 5 or 10 years. And we've got to address these two fundamental issues: 130,000 vacancies in the health service, 160,000 in social care, and a £10 billion backlog in terms of the estate. And it's only when we fundamentally address those capacity issues that we're going to get the health service that we need and that we want.
It's interesting for you to talk there about, the health of the health service going into COVID, because, of course, ministers are very keen to talk about the impact of the pandemic exclusively. Now, you're talking there about the challenges of extra demand with the ageing population and how much more health service we consume in the later years of our lives. Now, the NHS, of course, is consuming an increasing amount of public spending. I think it's almost £200 billion a year, 20% of public spending continuing to rise. Is the problem that actually money isn't the only solution, that we need reform as well?
Well, I do think we can do things better. I think we can be more productive. But the problem is that some of the ways in which we're not productive are a reflection of that lack of investment. So let me give you a couple of examples. We spend a lot of money on agency staff, and that's a very expensive way of employing people. But that's because we don't have that workforce strategy. So one of the things I really welcome about the Autumn Statement is a commitment by the government to have a proper medium-term workforce strategy. Take another example. Almost every hospital in England, in Wales, in Northern Ireland has got wards full of people who could go home, who should go home. Hospitals are not a good place to be if you don't need to be there. You get deconditioned. Your situation tends to kind of deteriorate. Now, it costs more to have people in hospitals than it does to have them in care homes, and a lot more than it does to have them getting domiciliary care. But we don't have that social care staff. The lack of investment in capital means that services like primary care aren't as efficient as they ought to be. So we can be more productive, but it's not about kind of cutting away at bureaucracy. Actually, we have fewer managers in the health service than most other kind of systems, large systems like ours. It's about that medium-term investment in a better health service. A health service, for example, that can be better at diagnostics. So we find diseases earlier. So we all want a more productive health service. We all want a better health service. And to be fair to the Secretary of State, I think many of the things he's talking about, whether it's data, IT, devolving power, are in the right direction. But it's going to take time. We are not in the situation we want to be in. The demand is growing, and it is going to take time for us to rebuild the health service.
You talked there about social care. Were you disappointed that there wasn't more about social care in the Autumn Statement?
Well, there's some more money for social care. I mean, the government faced a difficult choice, which is that most of the extra money that was dedicated to social care in last year's Autumn Statement was going towards the cap on social care costs. Now, the government has put that off for 2 years. That's an unpopular thing to do. But by doing that, there's more money which can go into the front line. And I think on balance, given that resources are limited, that was probably the right thing to do, because when you've got 170,000, 160,000 vacancies in social care, the situation just grinds to a halt. And if you talk to anyone in local government who's trying to recruit people into social care, the fact is that the cost of living crisis is hard for everyone, but the private sector in the end can pass on extra costs. It can raise wages. And I speak to people every day who work in health and social care, and they talk about staff leaving to go and work in warehouses, to go and work in retail, something which intensifies in Christmas. So that situation is deteriorating. So in a perfect world, there'd be more money for social care in the front line, and we'd be able to carry out the reforms that Boris Johnson unveiled some time ago. But given the choices, the really important thing is to get that money to the front line and to, for example, get those people out of hospital who don't need to be there.
It's interesting as well to hear you talking about the issue with staff in the hospitals, but also in social care as well. Has Brexit had an impact on that?
There's no question that Brexit is part of this, and the government themselves has taken measures to bring more staff in from around the world, because we have labour shortages everywhere, and they're particularly acute in health and care because we don't pay very much and because the work is extremely demanding. But yes, Brexit cut off a supply of labour, and we've had to scrabble around now to try and bring in people because, without overseas staff, our NHS simply would not work.
And then finally, hundreds of thousands of nurses have voted to strike. How much impact is that going to have on a health service this winter that, as we've already talked about, is already feeling a lot of pressure?
Well, to be fair to the RCN and the unions, they've committed to the fact that they will not disrupt emergency or critical care. But clearly, as you say, the health service under the kind of pressures I've described, industrial action is just another pressure on top of that. Now, I welcome the fact that the Secretary of State is keeping negotiations open, keeping discussions open with the unions. The government has committed to bringing forward the pay review for next year. So hopefully there are grounds for finding a way through this. But it's important to say that, even if the trade unions weren't threatening industrial action, with the 130,000 vacancies, we have an issue about how we recruit, how we retain, and how we motivate our staff. So we're going to have to look at this pay issue if we're going to have the staffing that we need. And it's not just about pay, it's also about morale, it's about the workload that people have to deal with. But at the moment, as an organisation that represents NHS leaders, all I can say is I hope the trade unions and the government continue to talk, find a way through this. And if there is more money to be made available for pay, it is really important that that money comes into the health service, because we don't have spare capacity to meet higher wage.
OK, thank you so much for being on the programme this morning. Really interesting to talk. Matthew Taylor there.
Thank you.
Really good to get lots of different views on the NHS and the challenges that are going forward. We've also, of course, been focusing on the story about Awaba Ishak and looking at housing as well. And we can now speak to the former Children's Commissioner for England, Anne Longfield. Good to have you on the programme this morning. Thank you for being here. Now, of course, you've spent years working with vulnerable children and families. Are there other young people like Awab living in dangerous conditions, and what needs to change?
I think that's undoubtedly the case from everything we know, everything we hear from those that are working on the front line, everything we see on our screens. And I think we should be shocked by this, but we should be really angry too. These are absolutely pointless harms and needless harms. They can be prevented, and that needs to be the focus now. We heard earlier about the awful conditions. I've seen some of those. I have spoken to those families who live there. We are talking about cramped conditions, but cold, mold, rat infestations, places which, as the coroner said in Awab's case, really are not fit for human habitation. So we can see that the Secretary of State is taking this forward. My message to him would be to make this a mission. It's in plain view, it's in front of us. It's one of those things that compounds so many social problems around children growing up in poverty, but it needs that determination and leadership.
The one thing that's really sort of troubled me about this case is his parents saying, we cannot tell you how many health professionals we've cried in front of and housing staff we've pleaded to. And Kwajo as well saying that he's spoken to people who have been complaining about things for 27 years, about his own family, talking about the living standards that they were in before his father died. Why is it that some families are listened to and frankly others are not?
Well, it's a very, very common message from families that they ring, they complain, they get ignored, they have to wait months and years, nothing happens. If it happens, it's not fixed properly. There does seem to be a mix. Certainly, there's also the element of prejudice, which is rearing its ugly head in this too. But expectations just aren't high enough. We should demand more. Yes, of course, cash is stretched, but that is absolutely no excuse. There has to be much more of a focus on what tenants are saying and that customer care, which seems almost non-existent. There's almost this kind of feeling that, they should take it or leave it. And I've spoken to families where they've had to sofa surf with children, be in temporary housing, move across parts of their area. And of course, that has an impact on not only their physical health, but their mental health, their schoolwork, family relationships and stresses. And it's part of the misery that we have of children growing up in poverty. And I think we have to use this not only as a defining moment for social housing, but also a defining moment for what we want as a country around children growing up and growing up well. And at the moment, we've got 4 million children living in poverty, not thankfully all in the dreadful conditions that we can see with Awab's situation. But still being held back in every part of their life, and it's a waste. We're not investing in solutions. We're paying huge amounts to deal with crisis, many, many billions.
Now, you have worked a lot, obviously, about on young people. You've recently published a report, the Commission on Young Lives. You can understand, can't you, why young people feel hard done by today, frankly. You know, they can't get on the housing ladder, they pay more for their university education than their parents ever did, the debt burden is ever rising. I think it's the second highest departmental expenditure budget under the NHS, our debt interest payments. You know, are young people right to feel that actually things are a bit unfair?
Well, I think young people it is fair that they look at the world around them and they think that, they can see that they've not been at the forefront of decisions that obviously struck home to many young people and children when, during the pandemic, schools stayed closed while pubs, theme parks and shops opened. So they haven't been at the forefront of decision making. And for those, I think all children feel it. They also feel that there's so much uncertainty about their future that they simply wouldn't have felt 10, 20 years ago. But for those kids that are growing up in very difficult circumstances, I think that there's so many additional pressures. They feel marginalised, they can't see a future, they don't have that hope about getting onto the job ladder. Many, a fifth of all children leave school without basic qualifications. And for those children who can't see their future and their progress within, what we would see as mainstream, they may start to look elsewhere. And we've had a report this week from the Centre for Social Justice that said there are around 2 million children who aren't attending school now regularly, many where parents are taking them out of school and educating them at home because they've kind of given up on not getting that support. So again, really the need to target much more help at families and children to prevent problems and get to the heart of those social problems rather than watching them emerge and then having to pay the very high price.
We, of course, spoke a lot during the pandemic when you were Children's Commissioner, and we know how lockdown impacted young people and children, whether it was the closure of schools, whether it was people being ordered to stay in their homes, where sadly some people are not in the best conditions or are not safe. Are we still picking up the pieces from that lockdown, and is enough being done?
We are, and I think we're only just starting to see what that means. Of course, MPs see this because they see it in their constituency bags and in their offices all the time. And more are saying to me, look, I think we're only just seeing the mental health impact of the pandemic. But it does go much further than that. Those children who were living in the most disadvantaged families, the most disadvantaged areas, lost more time in school and are now further back. We haven't had the kind of almost childhood recovery that I think was once envisaged by the recovery commissioner that we saw temporarily imposed. It's been a very narrow view of recovery. And of course, with the cost of living crisis and families being under more and more pressure, those social problems are only getting deeper and deeper. And frankly, with the thought, yes, of course, there's been some respite this week with benefits and with schools, but with the thought of further cuts to public services coming down the tracks in a couple of years' time, that's a terrifying thought. And again, much more of an emphasis needs to be put on investing to turn those problems around, getting poverty down, helping release these children to have the kind of futures we all want. Because if we want growth, we do need to get these children being able to get to the position where they're able to have bright futures and make the most of the chances that hopefully will come their way.
Thank you so much for being on the programme. Really interesting to talk, as always. Anne Longfield there.
Thank you.
And now, before we go on to the next part of the show, which is The Take, where we have half an hour look back on the interviews, what we've learned with Sam Coates. A quick reminder, our midweek programme, The Take, is back again this Wednesday. Now, that's our chance to take the political temperature during the week. It's been quite newsy, I guess, in recent months, to say the least. Lots of interviews with big guests, analysis from our journalists and data, and our regular viewers panel as well. Now, The Take, live from Westminster, Sky News, Wednesdays at 9 p.m, so do join us there. We've also got the Sophy Ridge on Sunday podcast, which will be available after the show. That's around lunchtime, some highlights from the interview, some analysis. Today, it will be myself, the Daily Mirror's John Stevens, and our programme editor, Scott Beasley. So you can find that and subscribe wherever you get your podcast, Sophy Ridge on Sunday podcast. That's it for this week's programme. In a moment, we'll be talking through today's interviews with Sam Coates, our Deputy Political Editor. Thanks for joining us this Sunday morning. Hello, good morning. Welcome to Sophy Ridge, The Take, where we look in a bit more detail at some of the things we talked about with our guests in the last hour. It was a really busy show. We talked about lots of things, from the NHS, that was a big focus for us, to Brexit, what the government's going to do about it, the impact it's having, and also housing after the really sad death of that 2-year-old little boy. It's really moved me last week, so I was glad that we managed to do some on that on the programme today as well. Now, let's bring in, shall we, our Deputy Political Editor, Sam Coates, who is here with us every Sunday to give his analysis about some of the big things that are happening in Westminster. Thanks for being with us, Sam. So it feels like we had the big week this week with the autumn statement on Thursday. We're starting to get a bit more of a sense about who Rishi Sunak is and what some of his priorities are going to be. Where are we this morning?
Well, it's fascinating, isn't it, Sophie, because when we sat there on Thursday, we were watching politics being redrawn once again. 8 weeks ago, we had a Conservative Party that wanted to borrow to fund tax cuts. Now you've got a Conservative Party that's going to spend over the next 2 years more money on public services, but then do deep cuts They say that they're going to bring down the debt and the deficit, but actually they're going to borrow more. So we're all having to get our heads around quite fast, quite quickly changing situations. And so, frankly, is the opposition. And as you say, it was a really busy show. There were lots of different subjects on the agenda. But if I had one reflection about the whole show, in the round, it's that when you listen to this iteration of the Conservative Party and this iteration of the Labour Party, the actual policies that they're putting forward, the suggestions that they're making aren't that different. And when I listened to Jonathan Ashworth, basically what he seemed to be saying was we don't have an alternative plan to the Conservatives. We would just do pretty similar goals, but try and do it better. And whether that's sorting out nurses' pay, the direction of the NHS, yes, there'd be a bit more funding from Labour, but it's not a transformationally different plan to the one being put forward by Steve Barclay this morning. Or when it comes to Brexit, which is the subject that I want us to start by talking with, then basically Labour would come in and have pretty similar goals, but they think they can just do it better. And that discussion about Brexit has all been fired off by probably quite a controversial article on the front page of the Sunday Times this morning, suggesting that the new Rishi Sunak government, in yet another change of direction, just one of so many we've had recently, when it comes to Brexit, want a much closer relationship with the European Union than the one being pioneered either by Boris Johnson or by Liz Truss. And that, of course, is going to end up being very controversial, not least with the Conservative Party, and so the government's doing a bit of firefighting this morning.
Well, I don't support that. I want to maximise the opportunities that Brexit offers. That's what I worked for as Brexit Secretary, and as the Minister responsible for life sciences, I see huge opportunities for the UK in being agile, in moving at pace and having a regulatory system that is absolutely tailored to the UK needs. It's in both sides' interest to remove barriers. We trade with each other, we're important partners to each other. So that's mutually beneficial. And of course, we want to work constructively with EU partners to do that.
That was Steve Barclay there, as you were saying, on Brexit. It was quite interesting talking about his reaction, I thought, to the Sunday Times story. He really poured cold water on it. And I was just trying to work out how much of that is Number 10's line, they want to kill the story off, it's not going to happen, or how much of it is Steve Barclay, because he doesn't like it, he obviously backed Brexit. What's your sort of reading of that?
So, undoubtedly, Steve Barclay, a committed Brexiteer, doesn't like it. I think, if I'm being honest, Sophie, I don't recognise formulation, which is the one that Steve Barclay used about the Sunday Times story, is perhaps at the less categorical end of the various denials. I think there's no doubt that Number 10 and Steve Barclay don't like this story being out there, but that's different to it not necessarily being true. What is certainly true is that ministers want fewer barriers when it comes to trading with the EU, and what's just a fact of life is that in order to achieve that, you need to do things in a more similar way to the European Union. There's lots of discussion at the moment from commentators about whether or not the end of Liz Truss and the way that Rishi Sunak has begun the kind of governing style that he's got does mean that we're going to end up with something a little bit closer to the European Union than had been envisaged by Boris Johnson. And that does feel to me quite likely. The government's going to just not want to talk about what the Sunday Times wrote, but it can't escape it forever. Very soon, it's got to set out its approach to the Northern Ireland element of Brexit, which will either result in a closer relationship, perhaps more use of European courts in Northern Ireland, or it's going to result in an unholy row as ministers say that we can't put up with the kinds of agreements that Europe want in order to maintain a kind of closer relationship. We will know soon enough. The government can't duck this, even if they claim not to recognise what to do. And it's not like the opposition are proposing that we do things dramatically differently.
That's key, isn't it, Sam? It's interesting, isn't it? Because, we had Steve Barclay on the one hand saying, no, we do not want a closer Swiss-style relationship. That is not what we want. And then we also had Jonathan Ashworth from Labour, who I asked basically the same question to. And I have to say, he gave a pretty similar answer, I thought, to Steve Barclay. Let's have a listen.
We need to make Brexit work. We obviously need to deal with the problems in the Brexit deal. We do need to look at ways in which we can get more frictionless trade, because although the volume of trade on the world stage has improved, our exports performance is still disappointing. So there are changes that need to be made, but it is quite something that Conservatives appear to be briefing newspapers, or government sources appear to be briefing newspapers, suggesting that their own deal isn't working out as they told us it would.
Jonathan Ashworth there, he also did say, didn't he, that, Labour aren't looking at getting more access to the single market. I mean, is it one of those issues, Brexit, where Labour just don't want to talk about it anymore?
I mean, essentially, yes. Again, I think that Labour and the Conservatives have a much closer alignment in terms of their position than they really like to admit. Neither Labour nor the Conservative Party want to take us back into the single market. Neither Labour nor the Conservative Party are currently talking about taking us back into the customs union. Neither Labour nor the Conservative Party want to revive freedom of movement to allow people to go and live and work in other European countries and allow them to come here to do the same. But within that, I think the choice is whether or not to have a substantially closer relationship. And this is as it were, the option pioneered by Theresa May. You might, for those of us who've got the Brexit survivors badge of the last 5 years, remembered something called the Chequers deal, which, with all of that framework of not being part of European institutions, nevertheless maintained very close relations with the EU, which meant that we would be following their rules. That was her plan. She was turfed out of office by Conservatives for doing that, and Boris Johnson became Prime Minister. It just sounds to me as if there are bits of government that are going back to that plan. But the question is, my God, it was toxic then. Even if public opinion is changing a bit, and there are some polls to suggest that it is that a sensible route for Rishi Sunak, with barely the smallest of mandates, to be thinking about going down right now?
Sam, in my job, people often ask, would be your fantasy guest? If you could interview anyone in the world, who would you like to interview? And I have to say, Theresa May would be quite high up my list. I would love to do an interview with Theresa May, but she doesn't do very much at all, does she? But there's so much that I think she would be quite fascinating on right now.
If I'm being honest, the fantasy interview is Theresa May being honest, because we remember many interviews with Theresa May when she was Prime Minister. She hates being interviewed and she clams up and doesn't say anything. So Theresa May 2.0, the kind of, unbound edition, would be interesting. Theresa May, as we got during her PM years, maybe less so.
Yeah, that's actually a very good point. Maybe Theresa May, not realising she's being interviewed in the pub with a glass of wine, would be the one to go for. Sam, thank you very much. Your face. Thank you very much. Lots more coming up after the break. We will be here, time to digest all of the things that we learnt on the show. Lots on the NHS to come.
Of course, a big build-up. We were so hopeful at the end of the summer, and it got scrubbed. And then we were hoping again in early October. No go. But yeah, now we've actually, we've had that amazing launch, and the sight of the rocket
nearly didn't go again. Apparently, they fixed it with a spanner in the last minute.
It's quite incredible, isn't it? I mean, there's a whole load of technology, and of course, there's something like 489 different criteria for go or no go, and that didn't include a valve that didn't quite, wasn't quite tight enough. And I guess it's the temperature that changes that tends to open these things. But yes, the technicians who actually made that happen, all hats off to them, and the teamwork that went with it.
Why do we want to go to the moon?
Oh, I mean, I suppose we'll talk about going back to the moon because, yes, we've been before, haven't we? The moon will allow us to find out an awful lot more about not only our own planet, it will allow us to find out more about what we need to do to go to Mars. It'll open up what we're hoping to be is a lunar economy as well. So materials that we can't make anywhere else that we can produce on the moon, partly to use in space, that we might use, let's say, for satellites to be able to beam energy, clean energy, back down to us on Earth, or perhaps it's just materials that we can use on Earth in our industries. So there's a whole load of different reasons to go, different spin-offs, but I think the main thing is really it's on the way to going to Mars. To be quite honest, right now, it's a really hot time politically. We could have done it sooner if we wanted to, but it is expensive. And we've got lots of different priorities and pulls on money. Yes, we need education, we need our healthcare, we've got a global economy that's been up and down, and there's so many things going on. But in the end, I think it's been decided that because of China and the Chinese desire to return to go to the moon. I mean, they haven't been yet, but there's this race to get particularly to the South Pole, where there might be ice and other important minerals, particularly rare earths. So, yeah, there is now a political reason to go to the moon now rather than 10 years ago.
Would you like to go?
Oh, I'd love to go. I think, I can't imagine there's an astronaut who would say they would not want to go to the moon. Yeah, and of course, then ultimately to Mars. That's got to be the real big ticket destination.
Hello, welcome back to Sophy Ridge on Sunday, The Take, where we take you back through the morning's interviews and we have some analysis from our Deputy Political Editor, Sam Coates, as well. Now, a big focus this week was the health service. It's certainly something that is really concerning lots of people today. And also, as we go into winter, A&E wait times, whether it's trying to find your GP, and all of that as well. Let's bring in Sam at this point, shall we? There was more money for the health service, wasn't there, in the autumn statement? But frankly, when I look at these graphs, particularly that A&E graph, that just shows that huge spike in people waiting more than 12 hours to see someone in A&E, it's actually really quite troubling, isn't it?
It is. There were three things that got more money in the autumn statements: schools, social care and the NHS. And obviously social care and the NHS, the government are very keen to link as solutions to pretty much two sides of the same coin as a problem. But the situation is extremely troubling, whether it was those voters that Fraser Maud talked to, the Sky correspondent who heard just how people's personal experiences were so bad, or the graphs, the sheer data that shows that the situation for waits in A&E and lots of other metrics is just as dire as it can be. The situation with the NHS is very bad. Now, one of the things I was most struck by this morning is it's quite clear that ministers think that there's a bit of a silver bullet answer. They are blaming the coronavirus pandemic, and they think that that can be used to justify and explain the bad situation of the NHS. It's quite clearly something that everybody would understand. But when you listen to Matthew Taylor, now he is the head of the NHS Confederation, which has ties to all the NHS Trust chief executives up and down the country. So he has a very close-eye view on what's going on. His point was that actually you've got to accept that the NHS wasn't in a great situation before the pandemic came along. Now, waiting lists might have been lower, waiting times might have been lower, but he says that there has been years of underfunding. So, as it were, the system was a bit more brittle, a bit more fragile, which is why the UK health system has responded far worse to coronavirus than perhaps some in comparator countries.
Yeah, let's have a listen. As you say, I thought it was really interesting, that qualification from Matthew Taylor after Steve Barclay was telling us about the impact of the pandemic. Let's have a listen.
Waiting list was much worse in the UK because we just didn't have that extra capacity. So we've come out of that, and this is the issue, this gap between demand and capacity. Now, we welcome the fact the Secretary of State has got more money out of the Treasury to deal with the impact of inflation. It's not as much as we need, not as much as we want, but we're grateful for anything that we can get.
It's always interesting doing interviews with people like Matthew Taylor, isn't it? I think it's actually quite important on a day when you have, like, the Secretary of State who is pushing the government line, to have someone who, broadly supportive of the government, but also saying, hang on a minute, that wasn't quite right.
That's right. Matthew Taylor, an interesting individual, of course. He worked as a policy advisor to Tony Blair, and so would fairly be characterised by ministers in a Conservative government as somebody with Labour credentials. But the truth is that he was on the wing of the Labour Party that was at the most reformist, perhaps the closest when it comes to policy ideas, to much of many of the people inside the Conservative Party. So I think he's an interesting voice. And more broadly, what Matthew Taylor was doing was saying, I don't quite like the language that Steve Barclay's using when it comes to the kind of changes that he's going to try and do to the health service. He doesn't like this idea of slashing pen pushers, dealing with bureaucracies, not least because it's a bit demoralising, not least because the idea that you'd have nurses and doctors dealing with payroll and bureaucracy possibly isn't the best use of their time. But he said there does need to be a conversation about the way that the NHS is managed. And when it comes to discussions about things like targets, he was far more open to that discussion, perhaps even than I was expecting. So actually, quite a nuanced message, certainly not all critical from Matthew Taylor. I think people like Steve Barclay, the new Health Secretary, will take some comfort from that.
Yeah, it was interesting, I thought, Sam, wasn't it, what he said on targets? Because this is the big story that Steve Barclay was briefing today. It's on the front page of the Mail on Sunday, talking about the bonfire of the pen pushers. The one thing that I did want to pick up on in the interview with Steve Barclay was where he was also talking about scrapping some targets. This is what he said when I addressed that.
There is a place for targets, but if everything's a priority, nothing's a priority. And risk, in my view, is best assessed on a population basis through the ICBs by local leaders. They're better able to tailor the priorities for the local needs, and we will have information such as through the federated...
Targets are important, right?
Of course,
okay.
Of course, and no one's suggesting we don't have any targets. But what I'm saying is there's £2.8 billion.
Do you want to get rid of the targets such as the A&E waiting times?
No, I think the A&E is a very useful target in terms of actually the wider system health within the NHS, and it speaks to flow, which is a key issue in terms of ambulance handover delays and people waiting in A&E.
Sam, the target thing I think is important because, you know, it's easy to look at this and think, yeah, great, let's just get rid of all that waste. We want to spend money on doctors, we want to spend money on hospitals. But actually, I guess my point on targets that I was trying to make is how do we assess how well the health service is doing? You know, whether that's people, you know, in the sector, but also people like you and I, when we're challenging ministers on whether or not the targets are being met.
I think that's absolutely right. And, you know, through the whole of the last 25 years of discussion about how to manage the health service, these issues have rattled around and we've lurched in terms of policy from one end of the scale to the other. New Labour back in 1997 brought in quite a lot of specific targets, but as the years went by, there was a fear that those targets became, as it were, almost distorting because doctors would try and ensure people received a certain type of appointment in A&E within a certain time, but that actually meant that the health care given to those individuals was secondary because meeting this artificial metric became the priority inside A&E. And so we looked again and targets became looser, and then but then there was a fear that there wasn't enough pressure being put on the health service to deliver, and so we went back in the other direction again. And we've been round and round this debate for 25 years, if not longer. It's a very hard one to strike a balance on. I thought it was quite interesting. Also, this is another area where we're going backwards and forwards. Steve Barclay suggesting that really accountability lies with the people managing local trusts. Now, again, we flip-flopped as a country on this under Andrew Lansley, under David Cameron's government in 2010 to 2015. Essentially, a lot of the decision-making about the NHS was pushed off to independent bodies. Ministers' message was don't blame us if things go wrong. Then more recently, as a result of the pandemic, ministers felt that they didn't have enough control of the health service. So under Boris Johnson and Matt Hancock, they pulled back the powers to themselves. And now Steve Barclay again talking about the need for local accountability, for local decision making. I think that's the kind of thing that the health service finds quite difficult to deal with when there are big structural changes being done, often for more political than good reforming reasons. Then that can cause quite a lot of disruption. But the bottom line is there are no easy answers, and neither answer is a silver bullet.
Yeah, certainly. I'm also interested, Sam, on your take on where the debate is between the two parties on some NHS things. So before we get your take on that, let's have a little listen to Jonathan Ashworth. Now, he's the Shadow Work and Pension Secretary, but of course he was Shadow Health Secretary for an awfully long time, so it's an issue that he cares a lot about. And I was interested to talk to him specifically about nurses. We know, of course, the Royal College of Nursing striking for the first time in their history. Do they deserve the pay rise that they're asking for? This is what he told me.
The buck stops with the Health Secretary. If he wants to avoid industrial action this winter, he has to get those trade unions in his office on Monday morning to get an agreement and hammer out an agreement. Now, we've not got access to all the facts and figures in the NHS because that's government information. But I am sure that if Wes Streeting was the Health Secretary, he would be getting the unions in for a discussion. And of course, we never had industrial action in the NHS under a Labour government.
Now, Sam, I feel like I'm getting that response quite a lot from Labour at the minute. We don't have access to all the facts and figures, so I can't answer your question.
Yes. And there's another part of the answer as well, which is, but don't worry, if we were in power, we would just be doing it better. But that's a lot of things to take on trust, to be honest, Sophie. The Labour message this morning, whether it's on Brexit, whether it's on the NHS, whether it's on pay rises, has all been, we're not going to set out a different course, but we are just better people at doing this stuff. And it's a question for voters whether or not they believe them and go along with that on the basis of frankly, at the moment, what's quite a thin answer. Sure, politics has changed a lot in the recent weeks because of the Conservative turmoil, and sure, it's going to take some time for Labour to catch up and change its response in relation to the new government. But you're not getting a lot out of Labour politicians at the moment in terms of cold, hard, firm facts in order to work out where they stand. That's different.
Seems to be working, though, if you look at the polls.
One poll had the Labour Party 21 points ahead this morning. And I think if the poll lead stays like that, you're going to start getting some panic from the Tory benches. I think Labour are being helped by the fact that there is so much turmoil inside the Conservative Party. And whilst that autumn statement, whilst the statement on Thursday by Jeremy Hunt and Rishi Sunak was designed to calm the waters, there's the potential for so much more Tory trouble ahead, whether it's on the reaction to those tax rises, worries about what would happen after the next election to public services, the worries we were just talking about when it comes to a softer Brexit, a closer relationship with the EU, how will Tory MPs deal with that, and the myriad of other difficult issues that Tories are having to get to grapple with as they have the third Prime Minister in this Parliament, one who doesn't have a mandate from the Tory members. None of this is easy, and in the end, Tory turmoil might just carry the Labour Party into power.
Sam, thank you very much indeed. That is it from Sophy Ridge on Sunday this morning. Very quick reminder, check out our podcast. It should be a good one this week. We've got John Stevens from the Daily Mirror Scoop Machine joining us, so definitely one to watch. In the meantime, hope to see you on Wednesday, 9 p.m. for Sophy Ridge, The Take.